Hi, I'm Rick Kaler. Thanks for joining me. Whether you support or disagree with the inevitable health care plan coming out of Congress, it'll be wise to pay close attention to the financial consequences of this legislation, whether you're an employer or an employee. Let's look at the first consequence, which will be higher taxes. The House bill puts an additional 5.4% tax on singles earning over $500,000 a year, or couples with over $1 million. The top tax bracket is already scheduled to rise from 35% to almost 40% in 2011. With the medical surtax, the top federal bracket will now be about 45% in 2011. The tax increase in the Senate bill, however, is a bit lower, but will affect more Americans. It increases the medical payroll tax for single taxpayers earning over $200,000 and couples earning over $250,000, which is about 3%. So what is your planning strategy? Regardless of which version becomes law, high-income taxpayers will want to accelerate as much income into 2010 as possible. Income from interest, rent, and dividends won't be subject to the Senate Medicare tax. So of course, the more income, that is interest, rent, or dividends, the better. Consequence number 2 will be higher premiums. Starting in 2013, the Senate bill will impose a 40% tax on health care policies with premiums above $8,500 for individuals or $23,000 for families. Now, at first blush, this may not appear to affect most Americans, but eventually it's going to hit almost everyone because the premium cap isn't indexed for inflation or increases in healthcare costs. Now, this is going to be especially true if the Senate version passes because it raises taxes on insurers who are going to be forced to pass on the expenses to policyholders. So let's take an example. I currently pay $1,000 a month or $12,000 a year for a family health policy. By most estimates, my health care costs are going to double within the next 5 to 7 years, meaning I'll pay $24,000 a year, which is going to trigger the 40% tax. So what's your planning strategy? One way to keep your premiums under the threshold is by dumping extra insurances like dental and eyeglass coverage. You could also consider raising your deductibles or setting up a health savings account. If you're a small business owner, consider adding a cafeteria plan or a medical reimbursement plan that will make it permissible to write off all qualifying non-deductible expenses. The third consequence will be higher employer costs. The Senate bill caps what employees can pay for medical insurance at 9.8% of their income. If the employer doesn't pick up the balance of the cost, the employee would be eligible to purchase insurance through one of the exchanges. The employer is going to have to pay a fine equal to the lesser of $750 times its total number of employees, or $3,000 per employee who enters the exchange. The result of this cap is that the lower the average salary of a company's employees, the more likely it's going to be that the employer may drop health care coverage altogether. So what's the planning strategy? Well, unless your company pays 100% of employees' health care, pay close attention to the legislation. One result is that employers could pick up more of the health care tab, meaning your costs are going to go down, the employers are going to go up, and they'll just pick that up. But another result could be that an employer offloads the cost of health care onto employees by just simply canceling their health coverage benefits altogether. It seems to me a win-win would be to reduce the employee's current pay or future pay increases to offset that portion of the health care costs that have been shifted from the employee to the employer. Employers should start educating employees soon about this potential problem so they aren't blindsided when that may happen. You might wonder why I haven't suggested raising your deductible and contributing to a health savings plan. Well, unfortunately, the effectiveness of these plans is diminished under both bills. They're going to cap annual contributions at $2,500. So if you do have an HSA, contribute the maximum you can this year, which is $3,050 for a single and $6,150 for a family, because this will be going away. So these are just a sample of the changes, though the bigger ones that I can glean, and I have not read all 2,500 pages, but just a sample of what's coming our way. And I'm sure there are going to be more. I'm sure some of these may become obsolete by the time this is passed into law. So I will cover more of those changes in my columns and videos. Thanks for joining me.